Well, good morning, folks. In our next segment of the series, we are going to talk about Medicare supplements. So, what to do about that gap in coverage between what Medicare pays and what is your responsibility. That can be pretty significant. Now, all the information we're talking about today comes out of this book right here, Choosing a Medigap Plan 2020. This is the guide from the government, from CMS right here. It comes from the government. And so this is the reference, and this is what we're using to give you the information today. If you need a copy of this, you can download it on the internet or give us a call and we'll email or send you a hard copy of it. So, getting right into it. Now, you know, Medicare pays most of your bill, but it can leave quite a bit behind for you to pay. So for Medicare Part B, you've got $203 annual premium and then 20% after that with no maximum. And with Medicare Part A for hospitalization, you've got over $1,400 day one, and then many thousands of dollars if you're in the hospital for an extended stay. That's all your responsibility. So what are you supposed to do to protect yourself from that risk? Well, you get a Medicare supplement. Now, there's a lot of Medicare supplements. There's 10 of them, in fact, available to new people coming into Medicare for the first time. And they're labeled A through N, and we're going to talk about them just kind of in general today. In subsequent videos, I'll go through each one, A, B, C, G, N, K, L, M, and N in individual videos. So we're going to break down each Medicare supplement plan, each letter plan, individually in other videos. So be on the lookout for that. But just in general, this is how Medicare supplements work. We're going to talk about Plan G as an example today, just to give you an idea and illustrate how Medicare supplements work. Now remember, Medicare Part A has quite a bit of out-of-pocket expense if you go to the hospital, and Medicare Part B has in 2021, this is the year 2021 in January when we're making this video, $203 annual deductible plus 20% after that, and then some doctors are going to be able to charge you an additional 15%, okay? So, what do? You get a Medicare supplement. And probably the most common one for new people coming into Medicare today, after the macro law went into effect on January 1st of 2020, is going to be a Plan G. And so the way a Plan G works, and the way really Medicare supplements in general work, is a Medicare supplement's only job is to pay your share of the Medicare bill. Okay, that's it. It's a little bit different from the insurance you used to. Medicare pays first, and then your supplement pays all or a portion of your share, depending on which plan you get. Okay, and Medicare has to pay first. If Medicare doesn't pay, neither does your supplement. It's a supplement to Medicare, not a replacement for Medicare. Okay. So if we're looking at a Plan G, just as an example, after you have met the $203 deductible, that comes out of your pocket. The first time you go to the doctor, you're going to pay the full bill up to $203 for 2021. After you've met the $203 deductible, then the Plan G takes over at 100%. So when you go see your family doctor the next time, what's your copay? It's $0. You go see a specialist, your copay there is $0. You go to the hospital, all your hospitalization is paid for. The only responsibility you have is that $203 deductible for Medicare Part B. So all your inpatient hospital, you pay $0. Outpatient surgery, remember that's covered under Medicare Part B. So as long as you've met the $203 deductible for the year, you pay $0 out of pocket. MRIs, CAT scans, x-rays, blood work, lab work, ambulance rides, emergency room visits, urgent care centers, what's coming out of your pocket? Absolutely nothing. Okay. Now, remember, Medicare pays first, and then your supplement pays your share. So, and because of that, Medicare gets to set the prices that they pay the hospitals and the doctors. The insurance companies don't have a say. Okay, if Medicare approves it, the insurance company has to pay. They have no choice. They're obligated by law. And Medicare sets the prices, not the insurance companies. Okay, So what that means is we don't have to have doctor networks. We don't have to have contracts and negotiated rates with doctors. So that means that you can go to any doctor or any hospital that you choose, as long as they accept original Medicare. That's the only requirement. And when you go, there's virtually no out-of-pocket expense after you've paid your $203 deductible. Okay, so you can go to any doctor you go. And because there's no networks, you're also not locked into this geographic service area where you have to live and obtain your services. So if you have a network type plan now, like an HMO or a PPO, you have to live in and obtain services in the service area. And if you move or travel out of the service area, your insurance might not work. With Medicare supplements, they go where you go. So wherever Medicare works, which is anywhere in the United States, Medicare supplements go with you. And some of the Medicare supplements, Plan F, Plan G, Plan N in particular, have foreign travel coverage. So they cover a little bit of foreign travel emergency expense that Medicare doesn't cover. That's a little added expense, has nothing really to do with Medicare. It's just an added benefit of a Medicare supplement. Okay, and you don't need there's no managed care. So if you have a managed care type plan now, like an HMO or a PPO, and you need something that's not just a regular office visit or an emergency, you have to get permission from the insurance company first. And they can say no. Okay. With Medicare supplements, Medicare approves everything that's medically necessary ahead of time in a book in black and white on the doctor's desk called the Schedule of Medicare Approved Procedures. And if the doctor wants to know something's approved, he doesn't have to call the insurance company and get permission. He just looks it up in the book. Okay. The insurance companies have no say. If Medicare approves it, the insurance company is obligated by law to pay your claims. Okay, so no managed care. Now, so one question that always comes up, Ron, if it's apples to apples, all these companies are the same as far as the benefits go, then why would the prices be different? And that's a good question, and it's very simply answered. Why would you want to pay more? It's a simple question. You don't. Under normal circumstances, you want to go with the cheapest, good A-rated company. Now, there may be companies that are B-rated or very new to the market that may cost a little bit less, but those companies are B-rated for a reason. We try to avoid those. So as long as it's a good A-rated company with a good long track record in the business where we can see what their history is, then that's what we're going to recommend. But here's what you need to know about that. Right now, when you're turning 65, you have this window of opportunity from 6 months before your birthday month to 6 months after your birthday month when you can get a Medicare supplement plan with no health questions asked. No health questions. As long as your check clears the bank, you've got it. But once you pass that 6th month past your birthday, if you want to get a new plan or change companies or change plans, you're now subject to medical underwriting. You have to answer a series of health questions, and based on your answers to those questions, you can be declined. So it's very important that you make a wise, well-informed decision now when you've got the opportunity. So what happens when you come to see us or when you call us on the phone is we're going to have a good long talk about your health. And if we feel that you're healthy now and you can be expected to stay healthy for a few years and be able to answer those health questions favorably in a few years, well, we're going to recommend that you go with the cheapest, good A-rated company. But one thing that we know is that these prices, they all go up over time. Every year you get a little bit older, every year your insurance goes up a little bit. And some companies that start out very low have a tendency to raise their rates a little more quickly than companies that start out a little bit higher have a tendency to raise their rates a little more slowly. And eventually this one is going to cost more than this one. Now when that happens, if you're healthy, hey, it's no problem. We'll just go shopping and find you one that's cheaper. But if you're not healthy, you might be stuck with it. Okay, so when we have our consultation, we ask you a few questions about your health, and we feel that you're not very healthy now and you may not be able to answer those health questions in a few years, we might recommend that you start out somewhere over here, because eventually this one's going to cost more and we don't want you to be stuck paying that higher price. So we're not just looking at what's the cheapest now, although that's important. We're looking at what's going to be the best for you several years down the road. Now that's pretty much it for Medicare supplements. Again, there's 11 of these things that are available to most people, and we're going to break each one of them down in future videos, so keep an eye out for those. But for now, if you have any questions about Medicare or Medicare supplements, please give us a call. The number is 830-217-6711. You can also find us on the web at t65s.com. So until the next video, have a great day. We'll see you, folks.